Welcome to this explainer. I want you to think of your body as an incredibly complex machine. Right at the center of it all is the heart, this absolutely untiring engine that pumps about 2,000 gallons of blood every single day. And it pushes all that blood through a sprawling 60,000-mile delivery ecosystem of blood vessels. To put that into perspective, that is enough plumbing to circle the Earth more than twice. No way, right? Well, today we're looking at what happens when that incredible system faces its absolute biggest threat: cardiovascular diseases. Number one, cardiovascular diseases are the #1 leading cause of death worldwide. This isn't just some abstract medical statistic, This is a reality that affects almost every single family on the planet at some point. And that's exactly why we need to understand it. More importantly, it's why this information matters so much to every single one of us.
Here is our roadmap for today. First, we'll look at the anatomy of the problem. Second, hidden culprits and causes. Third, recognizing the warning signs. Fourth, diagnosis and medical action. And fifth, taking back control.
Section 1. Anatomy of the problem. Okay, let's dive right into this. So, what exactly are cardiovascular diseases, or CVDs? Well, it's not just one single illness. It's actually a broad group of disorders that affect both the heart and the blood vessels. The core issue here is disruption. Your brain, your heart, your kidneys, these vital organs demand a constant, totally uninterrupted flow of blood, oxygen, and nutrients. When CVDs disrupt that critical blood flow, it leads directly to severe organ damage or even life-threatening emergencies. It's quite literally an ecosystem failure. And this failure can take a bunch of different forms, primarily falling into 7 major types. We've got coronary artery disease, heart attacks, strokes, and heart failure, which is where the pump just kind of isn't effective anymore. Then there are arrhythmias, or irregular heartbeats, hypertension, which is your persistent high blood pressure, and peripheral artery disease, which affects the arteries in your limbs. It's a super wide spectrum, but they all stem from a failure in that exact same foundational network.
Zooming in on coronary artery disease, or CAD, we see the foundational plumbing problem that triggers most of these heart emergencies. CAD is basically the narrowing of the heart's arteries. But why do they narrow? Well, it's because of a stealthy buildup of plaque, a process called atherosclerosis. Just imagine a pipe in your house slowly getting clogged up with debris over the years. Eventually, the heart muscle itself gets starved of the very oxygen it needs to survive and keep pumping.
Section 2. Hidden culprits and causes.
Now, there's a really crucial divide when it comes to risk factors. On one hand, you have the factors you literally cannot change: your age, your gender, and your genetics or family history. But look at the other side of this equation: high cholesterol, high blood pressure, smoking, diabetes, obesity, physical inactivity, an unhealthy diet loaded with salt and fat, and high stress. These are lifestyle choices and totally manageable conditions. It's actually incredibly empowering when you realize just how many of these factors are completely within our control. Section 3. Recognizing the warning signs. Let's slow down for a second because this is absolutely crucial. A heart attack and a stroke are both massive cardiovascular emergencies, but they show up very differently. With a heart attack, the warning signs include severe chest pain, pain radiating down your left arm or right up into the jaw, shortness of breath, and a very specific, terrifying feeling of impending doom. A stroke, however, is a blockage in the brain's blood supply, so the symptoms manifest neurologically: sudden paralysis, severe speech problems, or a sudden drooping on one side of the face or body. You need to know exactly what to look for when literally every second counts. If you even suspect a stroke, memorize the FAST rule. F stands for face drooping, A is for arm weakness, S is for speech difficulty, and T means it is time to act immediately. There is absolutely no waiting around to see if it gets better. You act fast. But listen, cardiovascular diseases don't always announce themselves with a sudden, dramatic collapse. We also have everyday warning signs. Things like angina, which is this tight pressure in the chest, unexplained shortness of breath, sudden dizziness, an irregular heartbeat, totally unexplained fatigue, swelling in your legs or feet, or cold sweats. Think of these symptoms as your body's check engine light flashing on your dashboard. It's your ecosystem telling you, loud and clear, you need to see a doctor right now. Section 4. Diagnosis and medical action. If you ever find yourself as a bystander during an active cardiovascular crisis, these are the exact actionable steps you must take to keep someone alive until the paramedics get there. First, call emergency services immediately. Do not hesitate. Keep the person as calm and still as possible. Loosen any tight clothing around their neck or chest. Definitely do not give them food or drink because they could easily choke. Monitor their breathing closely. And if you're trained and it's necessary, start CPR immediately. Your actions right here are the crucial bridge between the emergency event and the hospital doors. Once inside the medical system, modern medicine has an incredible arsenal to diagnose and repair the damage. Diagnostics involve amazing tools like ECGs, blood tests, and angiography to literally see inside the vessels. Medications play a massive role too, from statins lowering cholesterol to beta blockers actually reducing the heart's workload and antiplatelets preventing dangerous clots. And when the plumbing needs physical repair, surgeries like angioplasty with stenting, coronary artery bypass surgery, or pacemaker implantations can literally rewire and restart the failing system. It's pretty amazing.
Section 5. Taking back control. For folks recovering, cardiac rehabilitation and physiotherapy are absolute game changers. This isn't just about resting in a hospital bed, it's about active rebuilding. Through supervised exercise training, professional diet counseling, and stress management education, survivors learn to literally rebuild their heart's fitness. Breathing exercises and strength training help them reclaim their endurance. It transforms patients from victims of a disease right back into active, strong participants in their own health and quality of life.
So the crucial point is this. Whether you're recovering or just trying to prevent CVDs entirely, the strategies are largely the same. Eat a healthy diet rich in fruits and veggies and prioritize regular exercise. Keep your weight in check, and honestly, if you smoke, stop immediately. It's also super vital to manage your blood pressure and diabetes while making sure you actually go to those regular health checkups. Early diagnosis combined with these daily healthy habits can literally stop cardiovascular diseases in their tracks. Which brings us to our final takeaway. We've seen the anatomy of the engine, the hidden causes that damage the ecosystem, the terrifying emergencies, and the incredible medical interventions. But the single most important lesson from this entire explainer is that cardiovascular diseases are largely preventable. You have the power to change the outcome. So I'm going to leave you with this question. What will you do today to protect your heart tomorrow? Thanks so much for watching, and stay healthy.